think the first thing we need to do is roll call.
Yes.
Okay.
Board Member Lansky?
Here.
Board Member Rasbetter is excused. Board Member Skinner?
Here.
Board Member Mature?
Here.
Chair Carroll?
Here.
Fire Chief Eisenhower?
Here.
Thank you. So has everybody reviewed the minutes from the last meeting?
Yep. I move to approve.
You moved to
Second.
Second, all in favor? Aye. Okay, wonderful. So first we have our friend from Franklin County Public Health. Let's give us an update on the state of things.
Absolutely. Well, good evening, board. It's good to be with you guys on this dreary day. So I'd rather be in here than outside. So you have all of our divisional written reports that were sent to you earlier. So I'm happy to answer any questions on those. I did provide you a supplemental that that starts with the EPI report on it and has some additional documents on there that if we have a few minutes, I was hoping to go through that with you guys today. So. Yeah, awesome. So really wanted to kind of start off with where we are seeing with COVID right now. I'm sure you guys have heard a lot in the news that we are starting to see kind of that downward decline in our fourth wave, so that is amazing news. However, hate to be kind of that Debbie Downer a bit, we're not out of the woods yet. So if you look here at this first page, you'll see our current case count, but if I can highlight this red section here for you, this red box, it talks about our 7-day case rate per 1,000. There you go. Sorry about that. Per 100,000. So you can see we have been decreasing pretty steadily, but we are still almost 3 times the amount that we need to be to get down to the next category, which would be substantial transmission to orange. So really our goal is to get ourselves out of this red category and to get ourselves into, ultimately blue, but really we're hoping to the moderate transmission is what we are shooting for, where it's 10 to 49 per 100,000. And throughout this report, you'll see some of the data as it relates to onset date, reported date. If you go to the 5th page, you'll see the zip code level data where we can see Grandview there and the coloring, so we can see how that distribution of cases are across the county. That following page, it talks about how many cases specifically are in Grandview. And as of yesterday, we have 1,409 confirmed cases in 43212 zip code. So, and then in that following graph, you'll see that distribution, how we are skewing. At the beginning of the response and the pandemic, we were really seeing the older population. Now we are certainly seeing it there in the younger population. So. I know I went through that really quickly, so happy to answer any COVID-related questions on the EPI report that you might have.
I have a question.
Yeah.
Like if we follow the trend that we're on, how long would it take to get down to that 10 to 49 number?
Well,
I'm imagining it's months, it's not going to
yes, I believe so. And I think there's a lot of variables that kind of go into it, and that's what makes it a little difficult to give with the Delta, that kind of threw us into really, not tailspin, but that peak. I know, and unfortunately there's always going to be another variant that we kind of have on the horizon. I know right now we're monitoring Delta Plus. But the good news is, and that I wanted to talk a little bit about today, is that we have vaccine that is increasingly being more available to more population groups. So I think that's really the key to get us out of this, is to get as much of our population vaccinated as possible, still while doing these mitigation strategies as we can. But it's really difficult because we saw what happened the last time is, things improved. We all stopped doing some of these things, and then we have the Delta variant, and then we're kind of back to where we are. So I know we have some work with our partners at Ohio State College of Public Health around some modeling and some additional things that we continue to review as a county and then on the state level as we are continuing in this pandemic. So, but the good news about vaccine is that I'm sure many of you have heard that the FDA has met and they have approved 5 to 11-year-olds with the vaccine, so that's amazing news. Next week, the ACIP meets on, I believe, Election Day and the day after, so Tuesday and Wednesday. So we're expecting a recommendation to come out of ACIP and the CDC on vaccinating 5 to 11 with Pfizer. So that'll be great news. I know for us at Franklin County Public Health, we are working on putting together separate clinics because with this age group, it is a completely, different dose, different formulation, what have you. So we wanted to make sure that we mitigate any risk for errors or anything like that. So we will have some separate clinic opportunities, working with pediatric providers across the county. I know we have a really great partnership with Central Ohio Primary Care, who provides a lot of pediatric services. So really trying to do all we can to get vaccines for that age group. So we are definitely looking forward to when that happens, and I know that there's some conversations happening about trials with the other vaccines as well in that same age group. So, yeah.
Quick question, and it seems to me one of the lessons from last time when the vaccines became available for adults was we, not Franklin County Public Health, but we as a society missed the opportunity to do kind of groundwork with education.
Mm-hmm.
And I wonder if we're working with parents to prepare, if we're working with schools directly, and like the kind of communications piece.
Yeah, so that's a really good question. And so with our schools specifically, I know Joe, myself, and one of our other leaders around the schools, we actually meet with the school superintendents on a weekly basis. So we have those conversations. We've been working pretty lockstep with them. I know that they have partnered, a lot of them, with either like another hospital system or Nationwide Children's to provide on-site clinical opportunities. So I know they're really trying to be as, forward-leaning in it as possible to make sure that they don't miss an opportunity there. And then thinking about education, I guess outside of that, one of the recent successes that we had was we were able to fund 5 community-based organizations for areas that we were seeing lower vaccination rates. So our New Americans, our Asian, our Hispanic, our African American populations that we were seeing lower uptake. And we were able to provide funding to these organizations to be on the ground, to provide that information, to assist with vaccinations, but more importantly, be a trusted source of information, because we know as government that we are not always the best messenger. So working with the best messengers in those communities to improve rates. And as a result, they've been able to get over 1,500 people vaccinated. They've reached over 50,000 people. They've done some amazing work. So it's really taking a community to get this going and to have a sustained response to it. Well, speaking about vaccine, on the back here, I know that there's been a lot of conversation on the last page here, on that third handout. There's been a lot of conversation about boosters. It's just this little one-pager. It's like a little graph. I know for us, we've been a little bit confused by it, so figured maybe we could just talk about it very briefly. So talking about who is eligible for a booster, it's like a third separate document, yes.
It's in here. Okay, I got it. Thank
You got it? Okay,
Yeah.
cool. Sorry about that. So I know that there's been a lot of conversation about first dose, second dose, third dose, booster, like what is all of that? So as we know that the booster has been approved for all 3 of the vaccines. So this is just a little quick cheat sheet on like who can receive what type of booster. So if you receive Johnson & Johnson and you're older than 18, you can receive a booster dose anytime after 2 months of your initial vaccine that you received of Johnson & Johnson. And the same for all 3 of them is that you can receive any 3. So that is an option. I know one of the questions that we get is, which one should I receive, what booster? For us, we're saying which one is available to you is the one we would recommend. However, if you have concerns, certainly talk to your healthcare provider, talk to your doctor, and have that conversation about what would be best for you. For Pfizer and Moderna, the qualifications there are the same. So we have anybody over the age of 65, those who are 18 to 64 with those high risk of severe COVID, and those who have the frequent occupational or institutional exposure. And those individuals can receive a booster dose 6 months after their second dose. So I did want to, and I don't think my star showed up here, but at the bottom there is another category for individuals who could have received a 3rd dose, and this isn't a booster dose. This is basically for individuals who needed a 3rd dose to complete their initial series because they're immunocompromised. The CDC just came out that those individuals can actually receive a 4th dose now, which would be a booster dose, and then they follow the criteria above. So after they receive either, and those individuals can only for those who receive Moderna or Pfizer, after 6 months after that third dose, they can receive a fourth dose of any of the 3 vaccines. So hopefully that's clear as mud. I know it's complicated, so we are trying to put it together in a little bit simpler package there. So, and then last but not least is seasonal influenza. There's not too much with seasonal influenza right this second. This is actually only the 3rd week, I believe, in the beginning of the monitoring of seasonal influenza activity. So you can see here where we currently are as a state. To date, we've only had 6 influenza-related hospitalizations, and that's your second document in this packet that I have here for you. On the second page here, you'll see kind of the national landscape and the different colors and seeing about where we are with influenza-like activity. So we are in the minimal to low category, where we would expect to be at this time of year, and actually we're a little bit less than where we usually are. On the last page, there's this graph that shows 3 conditions, which are pneumonia, influenza, and COVID. One of the things we hear a lot about is like, oh, well, we shouldn't be too concerned about COVID because it acts like the flu, right? Like, so the deaths will be like the flu. But you'll see here that seasonal influenza, this baseline, is about 5.6% is how many, is about our mortality rate that we're looking at there. However, if you compare that to in the same time period to these 3 disease processes, it's nearly 21%. So it's 4 times more likely that you're going to pass due to this PIC disease process. So certainly something that is a stat that I think should be shared more often, that, you know, when you contract COVID, a lot of us are able to fight it off, but it can be deadly. And for 21% of folks, it is deadly. So I think that's about all I have around COVID, flu, and boosters, and then happy to answer any questions more about COVID or about any of the other written reports. So thank you very much.
Great.
Thank you. Are there any questions? So we have on our agenda that we were supposed to vote on our contract with Franklin County Public Health, but the price increase was within the margin that the council's already approved, so we can skip that, that item.
You could say we look forward to another year of working.
Yes, thank you, thank you.
A little more stressful.
Yeah, I feel like the work you've done over the last year, you probably should have added a little more in there.
I'll let them know that, yes.
Thank you very much for everything, and for us and the general area. I know this is not what you foresaw when you took on the job.
No, I think, yes, if you talk to any public health professional, none of us would have thought we would actually live through a global pandemic, so,
Yeah.
but, you know, but yes, but thank you.
So we all need a little extra from Centera.
Oh, yes.
Ms. Rinaldi, we can see through.
Oh, sure, thank you. For the presentation.
You want the laptop?
Sure, that way I don't have to say next to you. Thank you for actually inviting us tonight, me tonight, our agency. I don't know if you're familiar with Centero, but my name's Julie Irwin-Rinaldi, and I'm the CEO of Centero. And there might have been some other folks who would have joined me tonight, but they have children or grandchildren trick-or-treating, so I am a grandchild that was supposed to be trick-or-treating, so we'll see how that went, because as you noted, it started raining right before, or right when trick-or-treating has to start. If you're not familiar with our agency, we've been in business for 43 years. You may have known us as Northwest Counseling Services or Dublin Counseling Center. We merged in 2013, so we had 2 nonprofit organizations that were fairly the same size, around the same size, merged in 2013, and we became Centero. So both of us had been in business for about 38 years at that time, and it really brought the best of both organizations together. And it's been really a blessing because we've been able to serve more folks after that merger. Centero means support in Greek, in case you were wondering. People always ask that, and that was one of the things our directors at the time decided, let's change our name to really be something more meaningful and more comprehensive. So you asked me to talk about the impact of COVID-19 on children and adolescents, and so I'll talk a little bit about that. And please interrupt me anytime if you have questions, since it's a smaller group. I don't know if you can see this.
You can put it in a full screen mode if you want, or, I can help.
Probably still can't see it.
Yeah, it's kind of small. Slideshow?
Yes.
Yeah.
Clear glasses.
Yeah, I had a spot on there, I decided how I get it.
No. Is that right? Oh, oops, no, it's.
Yeah, there you
Oh, now I did, yay.
That's better.
Thank you, thanks. Okay, so so this gave me pause earlier. I looked at it a couple times, and I don't know if you can see it, but it's basically a little chart that I kind of skimmed by at first, and then I looked at it again a couple times, and I'll make this personal, and I know all of you have children in your lives, or you know children, you have family members. This basically gives you a little idea of what a normal year, the last normal school year was for children. And so I have a second grade grandson. So basically this chart says he's never had a normal year of school. And I went back and I was like, whoa. And I said, yeah, he hasn't. So he was in kindergarten in March of 2020 when everything stopped. And that really was disruptive. And so you can kind of relate that to anybody you know in your lives. And then in last year in first grade, he started the year with masks and social distancing and are we going to be in, are we going to be out? And then this year's been, less disruptive, but you can just kind of, you have your own stories to tell about that. But as I thought about that, I'm like, wow, like he really hasn't had what we would consider a normal school year. He seems like he's getting by okay, because most kids are resilient, but not everybody is, and this has been rough on everybody. So I just thought that was really powerful and wanted to kind of stop there for a second. Any questions about that?
I'll just add that, the word normal is a little tricky.
Yeah, the word
I would argue that since we've had active shooter trainings and all these things in schools, nobody's had a normal school year in some sense. So
Yeah.
there are different stressors, right?
Right, yep, definitely. So, so this just talks a little bit about, and I won't read everything, but just the disruption that students have experienced, and this is for all populations, but just, the increased stress related to the pandemic, that they're feeling not only in their peer group, but also just in their families, in the community, a lot of abrupt disruptions in their daily life, and then anxiety about the illness. We're all sitting here around in masks and not being able to see our full facial expressions, and just everything's different. Everything's different for all of us, and then trying to make sure that we're recognizing that in the little people in our lives and the folks that are growing up in this society right now. And then just social isolation. We've been really focusing on that with all populations and during the pandemic, and actually before that, really recognizing social isolation and loneliness are really, for all populations, really increasing, and something that we're paying attention to from a behavioral health care standpoint. And we already talked about this, just the interrupted connectedness at school. Here's another one. I'm so excited that there's going to be vaccines for younger children, but then that's another disruption or another unknown, and they're going to be hearing, all kinds of different things from the adults in their lives and also other children. So it's going to be really important for all of us to have good messaging around that, right? So I'm glad you guys are meeting with the superintendents and everybody's hopefully going to have good and positive messaging around that. So you can read that, but obviously we all know that a lot of things have been increased and a lot of things have been decreased, especially like access to certain things that happen during school that children were used to having, access to, like free and reduced price lunches and mental health supports and other kinds of supports that they didn't have for a while. So this just talks about just how critical services are that were dramatically reduced during the pandemic for children. And I think the part about this that I think is, kind of touched me when I was reading through this quote from this research is just, that roughly 6% of U.S. children ages 6 through 17 are living with some kind of serious mental health issue. Anxiety, depression, trauma-related, some kind of mental health conditions. And a lot of times we're providing a lot of support to those students, those young people in school. And there's a lot of stuff out there right now about whether that's the best thing to do in schools. We won't get into that argument. You probably know where I land on that one. but it just, that last line there that says kids were untethered from the people and supports they came to rely on. And to me, that's really powerful. A lot of children have a lot of supports in their lives, but a lot don't. And that's in all the communities we serve. We serve young people in very affluent communities. We serve young people in all kinds of different communities. And, kids became untethered from a lot of the supports for a long time. And I would not say that that's over yet, because there's still a lot of disruption right now and a lot of unknowns. So when children went back to school in 2020 and then in 2021, things were different. Again, social distancing, personal protective, PPE was people were wearing. There's just a lot of unknowns and a lot of changes, and that's continued. Heightened awareness of physical health. You were teasing Alex about you never thought you'd be working through a pandemic. As the head of leader of an organization, I never thought I was going to ever focus so much on our employees' physical and our clients' physical health. We did, but never as much as, everybody who's running an organization right now is dealing with really focusing on people's physical health more than we ever have. You want me to keep going? Yeah. All right. So just the psychological and behavioral responses to disasters and pandemics. When you look at kind of where folks land on these different areas, there's major areas like the, distress reactions, psychiatric disorders, health and risk behaviors, and resilience. And obviously what we try to do when we're working with young people is try to really focus on their risk and protective factors. How can we help them to really build skills to get through rough times? And how can we, that's one of the biggest jobs that we have is how can we help with their emotional and, well-being and really help them through each step of the way to get through a difficult time? And what are the skills that they'll need as young people and then as they get into adulthood to really address and respond to when things don't go exactly the way we want them to.
I guess I do want to just ask a question since, this is Grandview and we have a specific context like every city does. I wonder if the school board and people would agree with some of the general assertions about need and unfilled needs during the pandemic. I'm guessing they would in some level,
Yeah.
but I also know our school district went out of their way to fill as many holes and find it and workarounds and all those kinds of things. So I'm just wondering if, how we contextualize a little bit the way in which different school boards were differently situated and also did different things during the pandemic.
That's a good point. I'm going to talk specifically about Grandview in a second, but that's a really good point. We have had a really great relationship with Andy Culp and with his team for years. His wife used to work for us actually for a very long time. She's wonderful. But we've had a really good, strong relationship. And because it's a smaller district, that helps too, because we can then really pivot and adjust things based on whatever the current needs are. And we've actually done that quite a bit this fall. There were some things that came up and they're like, could you do some things a little earlier than you're planning to? So we have done that, and I'll talk about that a little bit. So these are just actual, depressing statistics about adolescent mental health, but just know that everything's going up. Anxiety, depression, substance abuse, you all know all of that. And then just what are we doing to actively engage with young people and actively partner with the school district and other folks in the community to improve upon these things. So these are some things that increased during the pandemic, and you all are well aware of these, I'm sure, in your roles on this board and in your roles in your professional lives. So, I mean, there was just the need for, the needs grew for, there were more people that were unemployed, there were more people that needed supports. And I will tell you that as the needs have grown, in every, I know in public health and primary care and behavioral health, we have huge workforce issues that we're dealing with. And everybody in every industry is, and that has touched us as well. We're not sure what the long-term implications of all of this are going to be for young people or for anybody of any age, but we're also being mindful that, the winter months are always, a time when we are concerned about increases in depression and anxiety. We're looking at the flu, looking at other winter illnesses that we want to make sure that we're staying on top of that are going to impact people in the community, especially little people. So these are just some things that we are trying to do in terms of providing for students, parents, and staff. And most of this presentation was created by our school-based clinician in Grandview. So she's well aware of all the things that they're doing, and she's doing in collaboration with the Grandview School District. So these are the actual programs that we're providing. So school-based prevention services. We have outpatient counseling. We have 4 offices that provide outpatient counseling. One is in Hilliard, in the Mill Run area, which is nice and central. There's one in Dublin, there's one in East Columbus, and one in Lewis Center. So most of the folks that live in the Grandview area, if they were to come for outpatient counseling, most of them would come to the Mill Run site. And then we have an intensive outpatient program for substance abuse for adolescents. That's at our Dublin office. So these are specific to the Grandview High School. So we're in all 3 schools. We have a full-time clinician, licensed clinician, who has great experience actually, that works very closely with everybody in the school district, from the superintendent on. And I will say that, last year when everything kind of shut down, Andy and his team were wonderful in terms of working with us to allow us to do everything virtually. For a great period of time, because we were concerned, even when the kids went back to school, we continued to work virtually through December of last year, because I wanted to make sure that our staff were healthy enough and stayed healthy so they could continue to work with young people. It actually was cool because we were able to do a lot more virtual programming with students and connect students from other districts as well. So we were actually able to maximize our ability to work with more students and more parents during that time, which was kind of an interesting outcome of the pandemic. So we do individual sessions with students, skill building groups, and universal classroom lessons. And we really do work with the district to, develop a very flexible, program and curriculum so that it meets the needs of each district that we work with. So whatever grant, we don't just come and say, here's a cookie cutter thing we do. We work very closely with the school districts to say, what are your needs? How can we meet them? And how can we do this together? So these are some of the things that we offered, and this is an example. This is a lot of words, but like this year, the school district said, hey, we're running into some things that we're concerned about. We really would like you to increase your support and your needs. Some of the supports and groups that you're doing earlier in the school year than you were planning. And so we were able to do that with our team. And then I mentioned the virtual groups. If you see down at the right hand, we did some winter wellness groups and summer groups, and then a fall wellness group that we're just doing now. And actually that was nice because, because some of that was virtual, we were able to do that with multiple school districts, which was really cool. And that was fun because the superintendents and some of the other leadership of the school districts really liked that because it brought kids together in a different way, and they got to kind of relate to each other in different ways that they wouldn't have otherwise, and meet students from other districts. Any questions about this? The rest of this presentation is really about like just different resources, and this can get sent out to you, but crisis and just other references and resources.
I have one question. The extent of your contracts with Grandview, it's with schools predominantly or entirely, or do you also work with the city in any regard?
You know, that's a good question. We do not have a relationship with the city where we do actual programming, but we do that with other cities, other local municipalities, and we would love to. So if there's anybody I can connect with, we would love to do that. We work with Parks and Recreation and different. We just did a very comprehensive program and assessment in Upper Arlington. We've had a long-standing relationship with Dublin. So yeah, that is definitely something that we just recently did a suicide prevention town hall with the city of Dublin's police department, which is very interesting to do during the pandemic, but also just as a city to focus on suicide prevention. It was very well attended and lots of interest there.
Can I ask Chief Eisenhower, so I mean, what kind of prevention work are we doing with with your folks and with police and others along these lines?
We have a, through our health insurance, we have a contracted company we use for our EAP, for our employee assistance program. So that's all built into that program. And I've known people that use it. We get a periodical update on uses, not what for or who, but I know it is utilized, and they offer various topics from financial counseling to mental health to divorce to an elderly sibling or parent, stuff like that. But yeah, I can't think of the name of the company right now, but we do, all our employees have access to that.
That's through the insurance.
Correct.
And you know, we're always willing to do any like special programming with the fire department, police department, any departments in any municipality that we work in.
And I know specifically the fire department has several organizations we work with for counseling after a run. It used to be called CISM, and it was made up of our peers. And if any department had an event, a horrible auto accident, something that involved a child, all the departments around have a trained person, and they would come over and counsel that person. So there's a tremendous amount of resources for us.
Yeah, so police and fire tend to like to have their own folks work with them after a crisis.
I think it's such a
get-
unique situation,
Yeah,
and we're such.
it's fine. And then, so we do have a CISM team that was trained by K-Work, who trained a lot of the other like fire department folks. But we do that like if a business has a crisis or a city has a crisis or there's another crisis in the community. A lot of times there's school districts that experience a crisis. We'll go in and provide support, and we'll do that with the school districts. So.
We've got state level national retreats through the IFF, our national union organization. They have a center of excellence that they built. There's several programs that are, I mean, it's not taboo anymore. I promise you, in the fire service, it's quite acceptable now to say, hey, I need some help with this, I'm struggling. It's a welcome change.
May I ask a question?
Sure.
Are your services available for like the faculty and teachers in schools,
Yes.
or are they, okay, so they're universal?
Yeah, and so one of the things last year that was interesting, we had a program funded through actually the Delaware Morrow area for first responders, and they came back to us and said, could you add teachers to that? And that has been overwhelmingly the group that we've seen time and time again access those services because they're really struggling. I mean, they've been through all of this, all of these things too. So yeah, it's a good question. Yeah, we've had, in fact, that's probably the majority of the referrals we get of teachers in crisis. Yeah.
curious what other programming you offer within the community. Or,
Yes. So we have the outpatient counseling, which would be mental health or substance abuse. We focus on trauma-informed care, so that's what we're known for. So childhood trauma or any kind of trauma, grief work. We have lots of different programming for folks who are grieving, for parents who are grieving the loss of a child. We do a ton of suicide prevention, and we do a lot of suicide prevention in the school districts. And we do the SOS program in those school districts, and Grandview included. So the outpatient program, we do have a crisis support team that will go out. Again, police and fire usually like to, do their own thing, which is great. But when just the other organizations in the community are struggling, we will reach out. And that's a 24/7 on-call service. I'm trying to think of other things that we do. We do a ton of education on a variety of different topics. We do have services that span all age groups, so we have a very robust older adults program, and so we do a lot of work in the community with older adults. We receive funding from the Franklin County Office on Aging and from different municipalities to provide services. Different municipalities have different models, like Dublin has Forever Dublin, where they've created a model we're working with to basically for aging in place services. Upper Arlington's have had one for quite a while. I don't know if Grandview has an older adult outreach program, but we will go into people's homes and do supportive services and try to link them to other programming. I don't know if any of
Yeah, it's fine.
Is Centerra a nonprofit or for-profit?
We're a nonprofit.
And I have 3 children in Grandview schools, and they've all done different courses that you've offered, and it's always been a positive
Oh,
experience.
good. Thank you. If it's not, let me know, but if it's not, don't let me know now. We can. No, I mean, it's been an interesting, I've been doing this for 36 years, and, we're all going through things we've never dealt with before, and just trying to really not act like we don't know the answers, so just trying to work with our partners to try to meet the needs. And this city and the school district has been wonderful to work with, and it's really been a joy. There's never been, we always are told yes, and let's figure this out, let's figure out how to work this out, and that's fun when you can do that in partnership with folks. Any questions?
Thank you very much.
Yeah, thank you. Thanks for the time.
That is all of our official business. Do you have anything you want to update from?
Some of it's interesting, and some of the reason why we chose this topic tonight is Mike Smith, our community medic, is really taking an abundance of mental health community referrals right now for his program. Specifically, we've been working on 2 this week, and they're exactly the things that you've talked about. So it is out there.
Yeah, I got a lot of calls from a couple of the fire chiefs we've been working with for a while, and the police chiefs say.
And it's people that should go to the hospital that won't. It's people that want to go to the hospital that can't, because the hospitals are all so taxed right now from everything they're seeing, and it's like a perfect storm of things right now. So we've seen it firsthand.
Yeah, one of the things we're finding in a lot of areas that there's a lot of adult children living in basements of parents' houses that have been living there forever and causing, having mental health issues, and the police get called, the fire department gets called. It's like, this is not what we were trained to do. So,
That's exactly right.
yeah.
We've seen people try to balance it at work and have to leave to go home and take care of a family, and someone else has to come in and work for them. It's just, all sides. But I think things are going good, and Mike's staying busy.
And the babysitting course.
Yes.
How did that go?
We didn't get a whole lot of feedback yet. So with COVID kicking back up, we kind of waited to get all the kids together. We're really waiting for the vaccinations to come out for that age and get everybody together. But it is still something we have and are planning on doing.
Okay,
I'd like to just raise one issue for its perspective, because, you know, now it's getting cold, so we're not in the mood of thinking about the warm weather. But I will just say, you know, after a summer with lots of things going on at the pool, I would love to talk in advance about, you know, there's things in the community, and I don't know what's right or what's wrong, what's true. But there is an interest from a lot of people I've talked to about understanding the training for the lifeguards at the pool.
Yeah.
And it's a messaging thing. It's understanding what is the training, you know, and really, so it might be a good time to start thinking about some proactive messaging before the season starts.
Yeah. I mean,
To
they
let
did
people
re-up
know.
the contract with SwimSafe, who they contract with for lifeguards and the pool services. And that's a great idea. Maybe get out what they go through, because I'm telling you, you'll be impressed.
Yeah.
And I think that's a great thing. Maybe we can get Mike to put out a little info on the requirements of what lifeguards go through.
I'd say that's smart, because I've heard from several people
Make a note.
that it's not impressive and they may be
Oh.
misunderstood.
Yeah.
So I think that this is a communication piece for the city to really think
I'll
about
make a note. That's a
helping
good
people
point.
understand. No better time than October to start talking about the
Well,
pool.
exactly. They can start getting it together, put it out if their spring comes around the corner.
Anything else?
Any update on the chat?
There has not been a lot of activity on the chat. The initial meetings were well attended, and then things have sort of dropped off. And so,
They haven't identified any areas yet.
no, we've been waiting for, some like demographic type stuff, and I
I
think,
thought this was
yeah, and so that, this is sort of the next step, and this is what we're, outlining going forward, but I do not have, I don't have anything else.
Thank you.
Thank you all.
Thank
you very much.
Thank you for giving your time and doing this important work.
Thanks for your presentation.
Appreciate it, so, thank you. Okay, thank you.
You gonna use that?
Pardon me?
Yeah, are you gonna use
Oh, I can. So, is there a motion to adjourn?
it?
A second? Okay.